I'm Dr. Alex Chasnis. I'm a physical medicine and rehabilitation specialist here with the practice. It's an area of medicine that encompasses a lot of different areas of specialties, including neurology, rheumatology, musculoskeletal medicine, and even orthopedics. All of these were things that I was interested in, and this gave me a great chance to kind of partake in all of those areas. Most people who come into our office, only a very small percentage of those people actually have a condition or a problem that requires surgery. Most of the time, back pain is a non-operative condition, especially when people are walking into the office as opposed to being seen in the hospital immediately after a traumatic event. And people really need that reassurance, because the truth is, most people who come into the office with back pain, a lot of them think they need surgery, and only a very small percentage of them actually need surgery, or even surgery would potentially benefit them.
Well, I'm the gas man on the number 14 Sprint Cup car for Tony Stewart, and my job involves lifting a 92, 93 pound gas can and running to the car with it, plugging into the car, and then running back with an empty can, grabbing another heavy one and running back to the car with it. So it involves a lot of heavy weights and a lot of twisting, a lot of movement, and a lot of stress put on my body. When I first injured myself at the racetrack, instantly the pain was at a 9.
Ace is a patient of mine. He does have a bad disc in his low back. It causes him significant pain from time to time, and he's been in my office sometimes to the point that he can hardly move. That disc is also herniated, and he's had concerns that he would never be able to do the things that he wants to do. I think communication between the patient and the physician is paramount. The biggest complaint I think I hear of patients after leaving a doctor's office is they're not really sure what's going on or what direction they're going to be taking, or if they are taking a direction, why they're moving in that direction. Sometimes as a physician, we can look at paperwork that a patient has filled out before they came in, or talk with them for literally 30 seconds and know what's going on. But we have to remember that that's not where the appointment needs to end, because the patient really needs to understand that whole process.
I was very happy with Dr. Chasnis and the way that he explained things to me about my back. I'm a very mechanical person. I work on race cars. I like to know exactly what moving parts are affected when another moving part is damaged. And he was able to give it to me in a way that I could understand it mechanically, and I wasn't worried about the different aspects of the injury when he told me exactly what was going on. So the way that he explained everything to me and made me understand it was the biggest help of anything.
I've been able to help him return back to doing all of the activities that he needs to do as the gas man. Most people, if they had the idea that somebody has a disc herniation in their back, they can't do those things. But in reality, we've gotten him back to do all those kind of activities, and he's doing it successfully, hasn't required any kind of surgery at all.
Well, since I've had the treatment on my back, I went from a constant pain level of anywhere from 7 to 9. And, I'm down to, probably a consistent 1 to sometimes a 2 or a 3, which is extremely manageable, and it's not affecting the way I do my job, which is the main purpose of the treatment that I got.